the endocrine system and immune system in 204-305 course. The reading assignment for you to read in the case that you may understand more clearly in the lecture. That is, the first is the advanced immunology textbook in chapter 7, just only few pages concerning about the cytokine. The next is the Kuma clinical medicine, chapter 19, and only few pages. And the third is the Harrison, also just only 3 or 4 pages. And another one, that is the article in the journal that you will request to read it, because it is the activity that I call it as the bring in question and answer. Okay, and this is the class activity that I like you to learn, that what are the things that you have to do in the class. The first is you have to prepare yourself by studying the PowerPoint, PDF, as well as the knowledge file. Okay, and then when you enter the class, you will have a quiz. Then I will give you a lecture, and the last activity is the question and answer. It means that everyone should prepare one question with answer when you enter the class. That is the question and answer that you prepare from the reading article, and I just list that for by the name list of your class as shown in the slide. The number 1 to number 9 will prepare question and answer each from the topic 1 and 2, and then you will see in the following line, number 10 and 20 each have to prepare question with answer in the topic of 3.1, 3.2, 3.3, 3.4, 3.5. For the number 21 to 25, the topic 4 and 4.1. For the number 26 to 36, that is, each of you have to prepare your question with your answer from the topic 4.2, 4.2.1, 4.2.2, 4.2.2.1, 4.2.2.2, and 4.2.3. And the list of the class, that is number 37 to number 46, that is one question and the answer from the topic 4.2.4, 4.2.5.1, and 4.2.5.2. And this slide shows the outline of my lecture. First, I'm going to review to you about the cytokines, its activity and its receptors, okay, as well as how it's related to the hormone. Next, we're going to learn the endocrine hormones that affect an immune response, and then I select 5 hormones, that is from the thymus factor, from the pituitary, just only for the growth hormone, from the thyroid, from the adrenal hormone, and then from the pancreas. Next, I'm going to teach you about the immune response that affect the endocrine gland, that is an autoimmunity. The last in the class, that is the class oversee, that is we will learn together that the bring in question and answer, what are they, okay? For the immune system, In this lecture, we will concentrate just only the cytokines, which there are the small peptide and the molecular weight or molecular size just only 5 to 20 kilodalton. And the meaning of the cytokines, that is cyto is mean cell and chi actually that is meaning for the movement, okay? And we will learn later that the cytokine activity acts as endocrine activity. This slide is a table show us the common cytokines of both innate and adaptive immune response. You will see in the table that the top one, that is the set of the cytokines of the innate immunity. I know that now we familiar with the innate cytokines, that is interleukin 1, TNF alpha, interleukin 12, as well as interleukin 6. These are the 4 innate cytokines that mention a lot, okay? And the lower part of the table, that is the cytokines of the adaptive immunity, that I think that you will think about the cytokines that we classify as the Th1 signature cytokine and Th2 signature cytokines, okay? For the Th1, I think that all of us will think about the interleukin 2 and interferon gamma. Actually, interleukin 2 represents both the Th1 and Th2 because it is the growth factor for T cell. So the major signature of Th1 is interferon gamma, the lower line, okay? And for the Th2 cytokine signature, that is the IL-4 or interleukin 4. This slide is a figure review to you about the characteristic of the cytokines. In the left hand side, in A, is the figure show you that cytokines will be released or produced in the cytokine producing cell upon this cell is activated, okay? And then the cytokines will be released out into the environment. Just only the cell that have the receptor specific for the cytokines will be activated, okay? And this cell, you can call it as the target cell for the cytokine. Upon the interaction of cytokines with specific receptor, it will induce some of the intracellular signaling pathway, and then the biological effect will be observed, okay? In the right hand side shows you that there are at least 3 actions of the cytokines that are released. The first one at the top figure of B, that is if the cytokine producing cell release cytokines and use these cytokines for itself, this is called the autocrine action, okay? And in the middle figure, you will see that if the cytokine producing cell release cytokines in the environment, and then the cell close to this or the nearby cell which has specific receptor will be activated. In this action, we call it as the paracrine action, okay? And the lower one or the bottom one, if the producing cell release the cytokines and cytokines travel in the circulation similar to the endocrine hormone, that is the cytokines can go to the target cell that far away from them. This is the action of cytokines that we call it as the endocrine action. This slide is a figure show you the various effects of the cytokines. Look at the left hand side of the figure first. The first effect of cytokines is pleiotropy. It means that one cytokine has many effects on many target cells. In the figure you see that IL-4 has pleiotropy effect. That is, IL-4 can act on B cell and induce the B cell to going on proliferation and differentiation, while interleukin-4 can act on thymocyte and induce the thymocyte to going on proliferate. The same, IL-4, interleukin-4 can let the mast cell to going on proliferation. Okay. Next, cytokines had the redundancy effect. You will see that in the figure, at least 3 types of cytokines, the IL-2, IL-4, and IL-5 have the same effects. That is, IL-2 can induce B cell to going on proliferation. IL-4 can induce B cell to going on proliferation. IL-5 can induce B cell to going on proliferation. This is called the redundancy effect of cytokines. Next is the synergy effect of cytokines. You will see that there are 2 cytokines that will help each other. That is, IL-4 and IL-5 will work together on B cell and induce the immunoglobulin class switching from IgM into IgE. Okay. The last one, that is antagonism. So that is mean that one cytokine can inhibit activity of another cytokine. And the example in the figure is the interleukin-4 and interferon gamma. Okay. You will see that as in the figure, interleukin-4 that try to induce B cell to going on class immunoglobulin class switching, but interferon gamma will block this effect. Okay. For the right hand side, show you that cytokines, some cytokines has the cascade induction. It means that one cytokine will induce another target cell to release another cytokine. Okay. Like in the figure, you will see that interferon gamma that released from the T helper cell will activate macrophage to release interleukin-12, and this interleukin-12 can activate another T cell. Okay. From the previous slide, we learned that cytokines have various effects, and this slide shows us that cytokines will regulate each other. Look at the figure at the left hand side, show you that for the activity of one cytokine, firstly, interleukin-2, which is the growth factor of immune cell, T cell. Okay. If during their activation, during T cells are activated, there is the production of interleukin 2, which will function as an autocrine activity. Okay, and in that environment, if the dendritic cell release interleukin 12, this will let the activated naive T cell to differentiate into T helper 1 and then release interleukin 2 or interferon gamma. Okay, and this interferon gamma will positively feedback in this figure, that is, will activate macrophage. Okay, but during the activation of naive T cell, the production of interleukin 2, then autocrine effect. But in that environment, there is the production of interleukin 4. This T cell will proliferate and differentiate into Th2 and synthesis or release more of the interleukin 4, which will help the proliferation of activated naive T cell to be Th2 cell. Okay, and in the right hand side figure, they shows us that these cytokines, okay, will induce different intracellular signaling and then express different transcriptional factor. For example, if interferon acts on the receptor of T cell, there will be the activation of STAT1 signaling pathway, and then there is the expression of T-bet transcription factor. Okay, when there is the T-bet expressed, this T cell will going on to be the Th1 cell. Okay, but at the right hand side, if T cell is activated or receive interleukin 4, different signaling pathway, that is STAT6, will be activated, and then another type of transcription factor, GATA3, will be activated, and then this T cell will proliferate to be the Th2 and release different cytokines, as we know. As from the previous slides, we know that cytokines can have the pleiotropic activity or synergistic activity as well as antagonistic activity, and one cytokine will play a role on one cell and induce another type of cytokine release. So that is the term that they call the activity of cytokines as the cytokine network. And if one cytokine control another activity of another cytokines, they use the term yin-yang network, the cytokine network or the yin-yang. Okay, the best example is the role of interleukin 12 and interleukin 4. You see in the left hand side figure, as well as for the inflammatory cytokines, which we know that we have the pro-inflammatory cytokines and anti-inflammatory cytokines, so it will control each other. We call it the cytokine network or the yin-yang. This slide shows the structure of the cytokines receptors. As we know that cytokine receptor should be able to activate the intracellular signaling pathway. Okay, so the structure of the receptor, the structure of the cytokine receptor should compose of many or more than one of the transmembrane molecule. In this figure, the table shows you that it is the dimeric molecule. At the upper row shows us that the cytokine receptor, sometimes it is the homodimeric receptor. The second row shows that cytokine receptor is the heterodimeric receptor, okay, and with the common chain, okay, that is one chain composed in the various receptor, okay, and we have heterodimeric receptor with no common chain, okay. We will see the heterodimeric receptor in the next slide, as well as they group the cytokine receptor in the TNF receptor family and chemokine receptor family. This slide shows you further that sometimes they classify cytokine receptors according to the structure and the chemical structure of the receptor. For example, in the left hand side, they call it as the immunoglobulin super family receptor. You will see that that is the immunoglobulin domain, the green part in the figure. That is the immunoglobulin domain. There are 3 immunoglobulin domain that show in the slide, and then they group the cytokine receptor in the class 1, okay, and class 2. And for the right hand side, they classify into the TNF receptor and chemokine receptor, similar to the previous slide. This slide shows you more about the heterodimeric structure of the cytokine receptor that we learned from the previous slide. This shows the common chain in the cytokine receptor. Look at the left hand side, the first one. They call it as the GM-CSF receptor family with the common beta subunit. Okay, look at the first set, that is receptor for GM-CSF granulocyte monocyte colony stimulating factor, okay, has the composition of the beta subunit, and you will see that the receptor for IL-3 composed of the same beta subunit, the same as the receptor for IL-5, which composed of the beta subunit as well. For the lower part, that is IL-6 receptor subfamily, that composed of the common GP130 subunit. You see at the start from the left hand side, that is the receptor for IL-6. You see the GP130, right? And then the receptor for IL-11, you will see is composed of GP130 as well. For the right hand side, that is the interleukin-2 receptor subfamily, that composed of common gamma subunit. You see the receptor for IL-2, which composed of 3 chains, it has gamma chain. For the receptor for the IL-15, it's also composed of gamma chain. The receptor for IL-7, which composed of just only 2 chains, they compose, one of it is the gamma chain. The same for the receptor for IL-9 and receptor for IL-4. The intracellular signaling pathway of cytokines. Upon the cytokines interact with its specific receptor, okay, the main intracellular signaling is the activation of the kinase enzyme, especially the tyrosine kinase, and then it is a cascade reaction that will activate specific transcriptional factor that will enter the nucleus and then induce the specific gene transcription and then translation and then production of certain specific protein. In the endocrine system, which there are glands produce biological active hormones and then release into blood and affect distant part of the body. This slide shows you the glands of the endocrine system. The bigger figure shows you many of the glands, but the small figure shows you where is the thymus gland. This slide shows the list of the endocrine gland and their releasing hormone. In the slide, there are 9 endocrine glands, but just only 5 of them that I'm going to discuss with you concerning with the immune response. That is the pituitary gland, the thyroid gland, thymus gland, adrenal gland, and pancreas. This slide on the figures show us that each hormone can interact just only to its specific receptor. Like thyroid hormone, it will interact just only to the thyroid receptor which express on the cell membrane, or the growth hormone will interact with the growth receptor, as well as the glucocorticoid hormone will interact with the glucocorticoid receptor that may present in the cell cytoplasm. This slide reveals for you that after hormone interact with its specific receptor, there is intracellular signaling pathway occur inside the cell. Main of the intracellular signaling pathway is by protein kinase and protein phosphatase activity. Next, the transcriptional factors will be activated and then it will go to the transcription of certain specific gene. Okay. In the figure show you the signaling pathway induced by the growth hormone and by the insulin. From the previous 2 slides show us or remind us that hormone and cytokines, the immune cytokines, have certain similarity. Okay, and this slide just only emphasize to you that for the cytokines, which is the immune factors, okay, the immune cells are polyproducers. So it means that immune cells can produce many cytokines. While for the endocrine gland, it is the monoproducer. That is, one endocrine gland will produce just only one hormone. Okay. This slide shows you that there is an endocrine system in immune system. It is a chapter in the Advances in Neuroimmune Biology, the year 2011, and I summarized some of them to show you. That is, the hormone, for example, the adrenocortical tropin hormone, right? The ACTH, and its receptor are found in the immune cell, both mononuclear cell and polymorphonuclear cell. Okay, that is, it's T cell, B cell, monocyte, as well as granulocyte are able to synthesize ACTH as well as it express the receptor for this hormone. Next, for the thyroid hormone, the T3 or triiodothyronine, okay, immune cells, the same set of the immune cell as the ACTH, can produce T3 as well as express the receptor. Natural killer cells has this characteristic as well. For the growth hormone, okay, the mononuclear immune cell, that is lymphocytes and monocytes, can produce this, and growth hormone is needed for either T and B cell proliferation. Okay, for the insulin, the article shows us that almost all of the immune cell, the granulocyte and the mononuclear cell, can produce insulin. The last one is the gonadotropin, the prolactin, the leptin. Okay, they are found in the mononuclear immune cell. This slide will show you the effect of the endocrine system on the immune response. And as I mentioned earlier, that there will be 5 endocrine glands that we're going to discuss. The first is the pituitary gland, and just only the growth hormone will be discussed. Next is the thymus gland, that is the thymic factor. For the thyroid gland, it is the thyroid hormone. For the adrenal gland, just only the glucocorticoid hormone that we will learn in the later slide. The pancreas, that is the effect of the insulin on the immune response. Now for the effect of the hormone from the pituitary gland on the immune response, the growth hormone will be discussed. Another name from the growth hormone is the somatropin, right? And it is the chemical structure, it is the peptide in the size of nearly 200 amino acids, and it is a single chain polypeptide, and its major activity, that is, it can act as the mitogen, that is the substance that can induce the proliferation of the cell. Okay, and for the other hormone from pituitary gland, I will not discuss. Okay, this slide shows you that what are the effects of the growth hormone on adaptive immune cells. Okay, first of all, the growth hormone acts as the hematopoietic factor. You know, the poietic factor, that is the factors that can enhance the hematopoiesis. Okay, as well as it has the thymopoietic factor that is specific for the T cell development. It has the effect on both T and B cell, and then can call them as the T and B cell stimulating factor. Enhance T cell proliferation, more of them go to the T helper cell, as well as it enhance B cell proliferation and induce the immunoglobulin synthesis. And for the effect on the activity, they show that growth hormone has the effect on T cell activity, especially for the T cytotoxic cell. For the effect of growth hormone on innate immune cell, okay, it has the effect on monocyte. It acts as the monocyte chemotactic activity, that is can call a trap monocyte. On the macrophage, it enhances the macrophage development. It enhances the inflammatory activity of macrophage. On the effect of the releasing of pro-inflammatory cytokines, the interleukin 1, interleukin 6, as well as the tumor necrosis factor secretion. The previous two slides show the effect of the growth hormone on both adaptive immune cells and innate immune cells at the development and the activation stage. Okay, so it means that there are growth hormone receptors on immune cell. Not just only that, the immune cell can produce growth hormone, and the growth hormones can has the effect as an autocrine effect and paracrine effect. Next, for the effect of the thymus gland on immune response, okay, that is the substance produced from the thymus, which they call as the thymic factor, and sometimes they have the old term as the thymolin. This is the non-peptide hormone. Okay, this slide composes of three figures concerning about the thymus gland. Okay, the top left hand side is the show you where is the thymus gland. Okay, and the lower text show you that the size of the thymus gland is not big, and it will have the maximum size at puberty. Okay, and just only not more than 40 grams, and this the size will be decreased, that is decline according to age. And then they show us that for the people that is more than 17 years old, the size of the thymus gland just only 6 grams. Okay, for the right hand side show you that thymus gland is important in the immune response. Remember that the thymus is what? The primary lymphoid organ, or the generative lymphoid organ for the development of T cell. Okay, that is the structure drawing figure of the thymus gland. You will see that the hematopoietic stem cell, or the precursor of the T cell, will enter the thymus gland. Okay, and that is the development of T cell occur in thymus gland. And the bottom figure of the right hand side show you that if someone lack of the thymus, okay, he will have the primary immunodeficiency status. Okay, and you can call them as the Dye-George syndrome. This slide shows you that for the thymus gland, it can produce substance that first they call it as the thymus factor, and later they can call them as a thymic hormone, or thymic extract, thymulin, thymopoietin, thymosin. That is a substance that produce or they found in the thymus gland. and the effect of this substance mainly for the T cell development and maturation. Okay, so they said that this thymic hormone or the thymus factor influence the T cell senescence. Okay, that is, if lack of these factors, T cell cannot develop. Okay, it will die, for example, or we have less of the T cell. So they said that the thymic factor or the thymus factor has the ability to rejuvenate the T cell. And from this idea, they just think that, or some group try to use this thymic factor in the treatment of AIDS. Okay. Another factor that correlate or associate with the thymus, they call it as the TSLP, thymic stromal lymphopoietin. Okay, this factor will be present in other organ apart from the thymus gland, and its effect that many of the immunology study show in the the last 10 years, that this TSLP that present in other organs will influence the development of myeloid cell, okay, especially for the dendritic cell to express certain CD marker like CD11C. So it will influence the development of certain T cell subpopulation, that is the Th2. This slide show you further from the previous slide that the effect of the thymic hormone, okay, the first example that is influence the T cell development, that you can call it as the thymopoietin, that is in the left hand side figure. You see that the precursor of the T cell, okay, will enter the thymus, and in thymus there will be the synthesis of the thymic factor or the thymopoietin that will influence the development of T cell, that you will see that it's they draw as the double negative cell. When you read or you see the term double negative, it means that they mention for the expression of CD4 or CD8. Okay, they cannot find both either the CD4 or CD8 expressed on the cell, and after that they will be going on development into C double positive. Now it is double positive, that is express both CD4 and CD8. Okay, and then they will going on to the process that we learned before, that is the negative selection and positive selection, and after that T cell will be mature into either CD4 positive cell or CD8 positive cell, and then release from the thymus to do their job in the secondary lymphoid organ. You will see when they express just only CD8 or CD4, now they call it as the single positive, the SP cell. Okay, for the right hand side figure show you the role of the TSLP. Okay, it will present in other part in our body, not just only in the thymus. And the TSLP you see at the nearly the upper part of the figure. This TSLP will influence the development of the dendritic cell, as well as the development of mast cell. So it will have the role in the development of Th2 cell and the hypersensitivity or allergic reaction. Okay. The effect of thyroid gland or the thyroid hormone on the immune response. This slide is a figure show you where is the thyroid gland and as well as what are the hormones produced in the thyroid gland. It is the thyroxine or T4 and the triiodothyronine, the T3, as well as there is the thyroglobulin, okay, which is the protein in the thyroid that will act as the iodine reservoir. This slide are the figures and table demonstrate the synthesis and the metabolism as well as the effect of the thyroid hormone. That is a figure and table from the Kuma page 960. Okay, so if you can look in the detail for the figure left hand side, show you that from the iodine, start from the iodine in the blood that will enter, and then that is the production of the T4 and T3 that will release out in the blood and go to the target cell like kidney, like muscle. And in the table show you various effects of the thyroid hormone. Okay. This slide shows the effect of thyroid hormone T3 or T4 on the immune response. Okay, it has the immune modulatory activity. It can change or deviate the ratio of Th1 and Th2 cell, as well as it has the effect on B cell, natural killer cells, macrophage activity. There is a study show that the T4, the thyroxine, can reduce the activity of the inflammatory cytokines. Okay, the high level of T3 or T4 will decrease the inflammatory cytokines produced from macrophage, but for the lower level of T3 or T4, it will have the opposite activity, that is, it enhances the phagocytosis activity by increase the reactive oxygen synthase production as well as increase the interleukin-1 beta production. The thyroid hormone also has another activity on the immune system, that is, it has the influence on the intestinal barrier cell. It increases intraepithelial lymphocyte, the IEL proliferation. It enhances the blood flow, okay, of the intestine, so it modulates the intestinal inflammation as well as it modulates the apoptotic mechanism in the homeostasis. For the effect of the adrenal gland or its hormone on the immune response, I will discuss just only for the glucocorticoid. This slide is a figure show you about the adrenal gland and their hormones. Okay, briefly summarize the hormones that produce from the adrenal gland: the mineralocorticoid, the glucocorticoid, cortisol, and androgen. And or review to you that it is under the HPA, the hypothalamus pituitary adrenal axis. This slide are the figures show you the hypothalamus pituitary adrenal axis, HPA axis. You will see the regulation between these three glands. Okay, and another figure show you the glucocorticoid synthesis in the adrenal cortex, which will have the cholesterol as the precursor. Okay, in the right hand side flow chart, you will see that the in the light green box show you the synthesis of glucocorticoid. Okay. This slide shows the effect of glucocorticoid. In the table of the left hand side, it shows the major action of glucocorticoid. Okay, look at the inhibitory activity. Okay, these glucocorticoids affect by inhibit the immune response. You will see that it decrease the host response to infection. It inhibits the lymphocyte transformation, inhibit delay hypersensitivity, and inhibit the circulation of lymphocyte. For example, for the right hand side table show you that compare the various steroid hormone with the activity of glucocorticoid. You see, there are many types of the steroid like cortisol, prednisolone, dexamethasone. Okay, and then they compare the potency of different steroid hormone with the cortisol. This slide summarizes some of the well-known effect of glucocorticoid on immune cell, that is the immune suppression. Firstly, that is there is the dose dependent of glucocorticoid on the immune cell. More of the studies show the effect of the cortisol. The cortisol will reduce the number of the mature B cell, only the mature B cell, and it affects the development or the synthesis of granulocyte. Okay, PMN, basophil, eosinophil, and the chronic treatment of cortisol will induce the lymphopenia. It also affects the thymic hormone secretion, so it affects thymus, as well as its effect on T cell, especially in the immature T cell, and T helper cell is more sensitive than T cytotoxic cell. The effect of pancreas on immune response, that is the effect of insulin on the immune response. This slide are figures for pancreas, their cells, and their hormone. For the left hand side figures just only show you where is the pancreas and name of the hormones from the pancreas, that is insulin, glucagon, and somatostatin, right? Just only insulin that we're going to discuss in our topic. Okay, and the right hand side figures show you that where is the beta cell that produce the insulin. It is in the what you call islet of Langerhans, and that is the lower right hand side. You will see the group of at least 4 color of the cell: the purple, the pink, the green, and the brown. Okay, and the pink color cell is the beta cell that will release or produce insulin. This slide describes the characteristic, the properties, as well as the pathology of insulin. Okay, insulin is a peptide hormone, and then they call it an O protein. That is, this is the protein that studied many years ago, in the 1,000 years ago. It's just only a small peptide composed of 50 amino acids and small molecular weight, that is just only 5.8 kilodalton. It composed of two chains. It is a dimer composed of A chain and B chain. It will react to its specific receptor, okay, and it can it can release out from the cell, go to the circulation. Its role is in the regulation of the metabolism of carbohydrate and store fat, as you know very well. The pathology from insulin first is the diabetes, okay, that is insulin deficiency in type 1 or insulin resistance in type 2 diabetes mellitus. And if there is excess of insulin, it is the pathology that called insulinemia, okay, and it can cause metabolic syndrome. This slide describe and show you the figure of the insulin receptor and its intracellular signaling pathway, okay. The receptor composed of alpha and beta chain. It is a transmembrane receptor, and its signaling pathway use the kinase enzyme, okay, the tyrosine kinase pathway, okay. But the insulin receptor not just only interact with insulin. Insulin receptor can interact with the IGF-1 and 2. IGF is the insulin-like growth factor, okay. So it will the insulin receptor can bind both with the insulin and insulin-like growth factor. The insulin and immune response. It is shown that some of the immune cells, like macrophage, granulocyte, can produce insulin, and the receptor for the insulin expressed on many immune cells, like T cell, B cell, okay. When they study deeply, they compare and show that the CD4 T cell will express higher number of insulin receptor than CD8 T cell, okay. In the condition that have the high level of insulinemia, okay, this can affect the immune activity, such as it increase the interferon gamma production from T cell, but it will decrease the activity of regulatory T cell, okay. That is, for example, the releasing of anti-inflammatory cytokines from Treg, the interleukin 10 is reduced, so it will prolong an inflammatory response, as well as insulin has the effect, high insulin affect the secretion of pro-inflammatory cytokine, the interleukin 1 beta from macrophage. But the evidence or the study does not show the effect on B cell. Now, this is the effect of the immune system on endocrine system, right? The previous I discussed with you about the effect of endocrine on immune system. Now, it is the effect of immune system on endocrine system. It is the role or the effect of adaptive immune response in the characteristic of lack of the self-recognition or the defect of the immune self-tolerance. This slide summarizes the process or the mechanisms of self, non-self recognition of the adaptive immune response. In the left-hand side figure, show that there are two steps of self-recognition. The first one the upper one, we know that it is called the central tolerance, or the mechanism of self-recognition that occur in the generative lymphoid organ for T cell develop, that is in the thymus. Okay, when the immature lymphocyte that express the receptor for specific antigen interact with the self-antigen at that step, that immature lymphocyte will going on either apoptosis, that is, it will be deleted, or if it is B cell, there is something change in the B cell receptor to be the receptor that does not specific with cell protein. Okay, or either the T cells will develop into the cell that we call the regulatory T cell or Treg, the natural occurring Treg. Okay, and then the lower figure show you that there is another step of self-recognition or self-tolerance that occur in the peripheral lymphoid organ. Okay, that's why we call it as the peripheral tolerance. You will see that in the case that the mature lymphocyte interact with the self-antigen, and in this condition sometimes it's not lack of certain factors like lack of co-stimulatory activity, that T cell will going on energy, that is doing nothing, or can go on apoptosis, delete that cell. Okay, as well as this mature lymphocyte can differentiate to another suppressor cell or the regulatory T cell, that we call it as the inducible regulatory T cell. Okay, for the right hand side figure, the upper one show you the role of the show you the role of AIRE gene, autoimmune responsiveness element, or autoimmune regulatory gene. That is the gene that will express the transcription or translation of the cell protein in thymus during T cell develop. Okay, so the developing T cell or immature T cell will going on the negative selection when they interact with this self protein. But if there is no activity of AIRE gene, so it means that lack of the expression of cell protein in the thymic cell. Okay, so there is no negative selection occur, and then there is the development of mature lymphocyte that's specific with cell protein, and this will be activated with cell protein that express in other parts in our body, and then induce an autoimmunity and autoimmune disease. Okay, the lower part of this figure show you the development of the regulatory T cell or Treg. That is, if there is a T cell that control the activity to cell protein during the cell develop in thymus, this T cell that express the FOXP3 protein, we call it as the natural regulatory T cell. Okay, but if there is a kind of T cell that express FOXP3 when activated in the peripheral lymph node, this regulatory T cell is called inducible T cell. They will have the same activity, that is, they inhibit the another T cell response. Okay, when there is the lack of non-self recognition or lack of the self tolerance, it will induce an autoimmunity. And the pathology of autoimmunity is an autoimmune disease. Okay. There are two types of autoimmune disease. The first is the systemic autoimmune disease, and the second is the organ-specific autoimmune disease. This slide shows you the table of organ-specific autoimmune disease, and there are 4 autoimmune disease that concern with the endocrine system. The first one, that is the first line in the table, that is Addison disease, which is an autoimmune disease of the adrenal cell. There is an autoantibody against the adrenal tissue or adrenal cell. Next is the fourth line, the Graves' disease, which is an autoimmune disease by the occurring of autoantibody that specific to the thyroid stimulating hormone receptor. The third is the Hashimoto thyroiditis, the fifth line. That is the autoantibody as well as the effector T cell that specific and interact with the thyroid protein and cell. Okay. And the fourth one is the insulin-dependent diabetes mellitus. That is an autoantibody as well as the effector T cell that's specific to the beta cell in the pancreas. The autoimmunity against the endocrine gland that causes autoimmune diseases are 4 types of the autoimmune diseases that going to describe further. The first is an autoimmune disease of the thyroid gland, both hyperthyroidism and hypothyroidism. An autoimmune disease of the adrenal gland, the hypoadrenalism or Addison disease. An autoimmune disease of the pancreas, that is diabetes type 1 or insulin-dependent diabetes mellitus. And there is a condition that called the autoimmune polyendocrine syndrome. This slide shows the table for the types of autoimmune disease that affecting endocrine organ. Okay, organ, and it shows the list of nearly 10 endocrine organs, and will show you the frequency of each autoimmune disease. Okay, see, like for the thyroid, autoimmune disease of the thyroid, it said that for the stimulating type, like Graves' disease, this frequency can occur in 1 of 100 person. Okay, in a destructive type, okay, like Hashimoto thyroiditis, the same frequency 1 in 100 person. But for the adrenal gland, it's a very low number, that is 1 in 20,000 per person. For pancreas that induce the diabetes, the frequency is 1 in 500 person. Now, for the immune response that affect thyroid gland or the autoimmunity to the thyroid gland, and then the pathology is the autoimmune disease of the thyroid gland. There are 2 types. The first one is the hyperthyroidism or Graves' disease. Another one is the hypothyroidism or Hashimoto thyroiditis. This slide shows the figures describe for the autoimmunity to thyroid gland, which will induce the hyperthyroidism or Graves' disease. the left hand side figure is a diagram showing us that there is a production of autoantibody to the TSH receptor, to the thyroid stimulating hormone receptor. Okay, and this autoantibody will continuously stimulate the thyroid hormone synthesis. Okay, it's not like in the left hand side of the figure that in normal condition the thyroid stimulating hormone receptor will activate by thyroid stimulating hormone and then stimulate thyroid hormone synthesis, which will induce the negative feedback control of the thyroid hormone secretion. Okay, in the right hand side figure, the same, show you that when there is the presence of autoantibody to the thyroid stimulating hormone receptor, this figure shows you that it is called thyroid stimulating immunoglobulin. Okay, and this will interact with the receptor, activate the thyrotropin receptor in this figure, which will induce the synthesis of T4 and T3 and then induce the hyperthyroidism. Okay, and this thyrotropin receptor can activate the orbital fibroblast as well as activate T cell to induce more of the inflammatory cytokines, which will cause the ophthalmopathy. The left hand side of this slide is a table show you that the hyperthyroidism can causes by many factors. Okay, the first that is common in the table is an autoimmunity to the thyroid stimulating hormone receptor that induce the hyperthyroidism or Graves' disease. Okay, and the uncommon that is the infection by virus, the post-irradiation, for example. And another type or another group of hyperthyroidism that is very rare, that is the tumor of the TSH secreting pituitary gland. Okay, for the right hand side figure is the figure show you that normal condition for the regulation of the thyroid hormone synthesis. Okay, that is the thyroid stimulating hormone that released from the pituitary gland will interact with the thyroid stimulating hormone receptor on thyroid gland and then induce the synthesis of thyroid hormone, and this thyroid hormone will feedback or negative feedback for the production of thyroid stimulating hormone. Okay, but in the right hand side column show you that if this thyroid stimulating hormone receptor on thyroid gland interact with autoantibody to this thyroid stimulating hormone receptor, there will be that activation of the thyroid gland to produce thyroid hormone. Okay, and the thyroid hormone going to feedback at the pituitary gland to stop the synthesis of thyroid stimulating hormone, but the thyroid stimulating hormone receptor on thyroid gland still be activated by the autoantibody to this thyroid stimulating hormone receptor, and then more and more or continuously secretion of thyroid hormone is occurred. This slide shows the figure of the hyperthyroidism, the Graves' disease. The upper figure shows you that there is the enlargement of the thyroid gland or goiter, as well as the bulgy eyes in Graves' disease or the hyperthyroidism. The lower part of the slide shows you the diagram that upon the activation of thyroid gland by autoantibody to the thyroid stimulating hormone, and that is the activity of T cell. Okay, this T cell will release cytokines. In the figure show you that there is the production of TNF as well as interferon gamma that will induce the fibroblast, the orbital fibroblast, which express the thyrotropin receptor, and it will induce the pathology of this orbital fibroblast. This slide describes an autoimmunity to thyroid gland as well, but in this case, an autoimmune disease occurring is the hypothyroidism or the Hashimoto thyroiditis or the chronic lymphocyte thyroiditis. Okay, it is the pathology by an autoimmunity of the autoantibody to the thyroid peroxidase as well as to the thyroglobulin, and it is the autoactivity of the autoeffector CD4 plus and CD8 plus T cell. Okay, the table shows you that what are the causes of the hypothyroidism. Okay, this can be the congenital, the defect of the hormone synthesis, as well as and the autoimmunity. Okay, like write down 3 types: the atrophic thyroiditis, the Hashimoto thyroiditis, and the postpartum thyroiditis. Okay, infection can cause the hypothyroidism as well. This slide shows the figure for the possible immune reaction in hypothyroidism. Okay, in this, it is a production of autoantibody to the thyroid protein. Okay, as well as there is the activation of cell recognition T cell specific to the thyroid protein. In the figure show you that start from the T cell that recognize thyroid protein. Okay, this T cell will be activated or sensitized. These T cells function as the helper T cell. The helper T cell will help the development of specific CD8 cytotoxic T cell, which specific to the same thyroid protein. So the CD8 positive cytotoxic T cell can interact and induce the cytotoxic effect on the thyroid epithelial cell. Okay, that is the left hand side. At the center of the figure show the role of the helper T cell, the CD4 plus Th1 that can release interferon gamma, and this interferon gamma will activate and induce the destruction of the thyroid epithelial cell. For the right hand side of the figure show you that helper T cell also help the production of autoantibody produced from the B cell or the plasma cell, and these autoantibody or anti-thyroid protein will bind to the thyroid epithelium and can induce the killer cell like natural killer cells to come and then destroy the thyroid epithelium cell in the process that called ADCC or antibody dependent cell mediated cytotoxicity. And the right hand side figure show you the what to call the looking of the hypothyroidism or Hashimoto thyroid disease. The immune response that affect the adrenal gland and cause the autoimmune disease, which we call it as the Addison's disease. Addison's disease is an example of an autoimmune disease of the adrenal gland. It is classified as the primary hypoadrenalism, and there is the presence of autoantibody against the adrenal cortex. The table shows the causes of primary hypoadrenalism. You will see in the table it is an autoimmune induction, as well as some of the infection can cause the hypoadrenalism like tuberculosis, like meningococcal septicemia. The immune response affects pancreas, another endocrine gland. It is an autoimmune disease that we call it as the type 1 diabetes or insulin-dependent diabetes mellitus. Diabetes type 1 or insulin-dependent diabetes mellitus IDDM is an autoimmune disease because there are the presence of both cell-mediated immune response and humoral immune response against the cell component. That is, there is the presence of autoimmune T cell, both CD8 T cell or CD4 T cell, that will induce the destruction of the beta cell in the islet of Langerhans in pancreas. The CD4 T cell, the Th1, produce interferon gamma that will induce further inflammatory cytokines production from macrophage that we know well, the TNF alpha and interleukin 1. Also, there is the presence of autoantibody to insulin, anti-insulin, as well as an antibody to the beta cell of the islet of Langerhans. Both of the antibody can induce the complement activation, or it can block the activity, that is the neutralization effect on insulin. This slide is a figure show the possible autoimmune reaction to insulin and cause IDDM. As mentioned in the previous slide, there is the stimulation of T cell. First, that is the CD4 T cell, and this autoreactivity T cells, will be activated and help the production or the activation of CD8 T cell that's specific to the beta cell that secrete the insulin. So T cell can go and destroy the beta cell directly, as well as for the T cells, CD4 T cell, it will release the cytokines, and then they write down as the chemokines that will activate macrophage, and as well as this CD4 T cell will release the cytokines that help the B cell that's specific to the insulin or the beta cell produce an autoantibody against the islet protein that right down there, and this autoantibody will go and destroy the beta cell, so lack of insulin production. What is an autoimmune polyendocrine syndrome, APS? It is an autoimmunity against the endocrine gland, and it can be divided into two major categories. The first is an autoimmune polyendocrine syndrome 1 or APS1, which is a genetic defect, and then the pathology occurs during the infant or in the infant. And another one is the autoimmune polyendocrine syndrome 2 or APS2. It is more common than the APS1. It will occur in the frequency of 1 in 100,000 persons. It occurs in female higher than male in the ratio of 3 to 1, and it occurs in adults, that is during the age of 40 to 60 years old. This slide shows the table of the disease associated with the auto polyendocrine syndrome. You will see that start with the APS1, the autoimmune polyendocrine syndrome type 1. What are the diseases? Okay, and for the APS2, what are the diseases? As well as there is the other autoimmune polyendocrine disorder in the table. This slide shows the table that demonstrates the comparison of APS1 and APS2. Overall, from this table, you will see that there is the role of AIRE gene and the role of autoantibody to cytokines, for example, to IL-17 and IL-22 in APS1, but none for the APS2. This slide is a table showing you the role of autoantibody and autoeffector T cell in APS2 as well as in other polyendocrine disorder. Okay. This slide are the tables show the investigation for APS1 or APS2. The example of rare autoimmune disorder in endocrine system. In this slide, show you at least 3 of the pathology. The first is the insulin resistant type B, which is there is the presence of anti-insulin receptor antibody. The next is the insulin autoimmune syndrome or Hirata syndrome. There is an anti-insulin antibody. The next is the Poems syndrome, the polyneuropathy, organomegaly, endocrinopathy, M protein and skin change, which is there is the presence of circulating immunoglobulin, a lot of interleukin 1 beta, interleukin 6, and TNF alpha. I just described to you about the autoimmunity to the endocrine system and cause an autoimmune disease of the endocrine system. So there should be a treatment of this autoimmune disease by the immune mechanisms that we call it as the immunotherapy. This slide shows some example of the immunotherapy. The first one is for the IDDM, the type 1 diabetes mellitus. They're going to use some of the modified anti-CD3, okay, and this will block activity of T cell, as well as they use the monoclonal antibody in the commercial name as the rituximab, which is the chimeric monoclonal antibody against the CD20, which is expressed on the B cell. Or there is the chemical drug that called mv30sep or Orencia, which is an Fc immunoglobulin that fills with the extracellular domain of TTLA4. So this component will block the activity of T cell. Okay. In the hyperthyroidism or hypothyroidism that caused by an autoantibody or T cell function in this pathology, they're going to produce a tolerogenic dendritic cell in the case that this dendritic cell cannot activate T cell, autoreactive T cell, okay, as well as they try to produce more of the regulatory T cell that will inhibit the activity of reactive immune cell. This slide or the figure show you the process or the mechanisms of immunotherapy. The first figure in the left hand side, that is the figure show you how the tolerogenic disease dendritic cells are developed and how they do their function. Okay, the start at the left hand side, the dendritic cell precursor, okay, can be induced to be the tolerogenic disease. In the presence of the low level of interleukin 1 beta, interleukin 12 for example, this dendritic cell, right, will release or be able to release the TGF beta transforming growth factor beta, which this will influence the effector T cell to become the regulatory T cell, and this regulatory T cell will produce more of the interleukin 10, which will function as anti-inflammatory cytokines and go to the or block the activity of autoimmune T cell that affect the thyroid gland. In the lower part of this figure also describe the activity of this tolerogenic dendritic cell that can activate the clonal expansion of regulatory T cell, and then we will have more of the regulatory T cell that produce anti-inflammatory cytokines and then block the activity of other autoimmune cell that stop the destruction or the activation of thyroid gland. In the left hand side figure show you the role of the monoclonal antibody against the growth factor receptor. This one is the EGFR, epidermal growth factor receptor. This receptor will express in certain women with breast cancer, and these molecules can be called as the HER molecule, HER molecule. So there is an immunotherapy for the breast cancer women that has the HER molecules on their breast cancer. They produce a monoclonal to this molecule and they call it as the trastuzumab. This monoclonal antibody will bind to the EGFR, epidermal growth factor receptor, and then will block the binding of the growth factor to this molecule. So the tumor cell or the breast cancer cell will lack of the stimulating agent, so they can stop their proliferation or their growth. In summary, this lecture tries to show you that there are two ways of the connection or the network between endocrine system and the immune system, which normally it should be in the homeostasis. Okay, and when there is the homeostasis, the host, that is all of us, will be happy. Okay, so it is a happy host. But when there is a defect of the immune system, the main one, that is lack of self-tolerance or lack of self non-self recognition. So there is an autoimmunity to the endocrine system, and then there is the pathology, that is autoimmune disease, and then the host is unhappy. The lecture is ended, okay, but you have other activity. That is the part of the bring in question with answer from each of you, and then the article that I assign for you, and the page that I assign for you. So I like you to show all of the class what is your question and what is your answer.